Hi guys, today our session is about cardiac output. So in previous session we talked about cardiac cycle. So at that session we learned how heart works as a pump to move the blood around the body. And at that session I have told you that heart has four chambers, two atria, the upper two chambers and two ventricles. They are the lower chambers. So just a quick recap, because to understand the cardiac output, you need to have the basic understanding about the cardiac cycle. Okay, as we talk about previous session, so the right atrium takes the deoxygenated blood and from body, and they come to the right atrium. So that blood is squeezed down into the right ventricle and taken into the lungs. So at lungs, oxygen replaces the carbon dioxide. Okay. At that, the oxygenated blood from lungs enters the left atrium. After that, blood is pumped to the left ventricle and starts its journey again throughout the body via aorta. So this is just a quick recap. Okay, and the deoxygenated blood from the body comes to the right atrium. From atrium, it goes to the right ventricle, and right ventricle, those deoxygenated blood goes to the lungs. At lungs, oxygenation happens, and oxygenated blood from lungs come to the left atrium. That blood from left atrium go to the left ventricle, and that blood goes to the whole body via aorta. So, what is blood? It's a special fluid primarily contained within the blood vessels. So, blood has main four components. They are red blood cell, white blood cell, platelets, and plasma. So, the blood transport throughout the body through veins, arteries, and capillaries. Those tubes or channels differs from in size and structure. Okay. So when we have a closer look at artery, capillary, and vein, artery has the thickest wall of drain. You can see it in this picture, and it allows to withstand a high pressure created by the heart. Okay. The vein, it is less muscular and stretchy than artery, so blood moves through it with low pressure. And veins has special valves, so in veins, blood goes through only one direction. Okay. In capillary, they have the thinnest. They allow substance such as oxygen and sugar to pass through its wall into or out of the blood. So basically, arteries carry blood away from the heart, and veins carry blood back towards the heart. So the capillaries assist in the exchange of substance between the blood and tissues. So now we go into our today's topic, cardiac output. What is cardiac output? Usually, cardiac output is defined as amounts of blood pumped out of each ventricle per minute, and we can express it in two forms: stroke volume or minute volume. So this is the equation we are going to calculate the cardiac output, stroke volume into the heart rate. As we talked in previous session, average heart rate is about 70 beats per minute, and average stroke volume is about 70 to 80 milliliter per minute, and average cardiac output is 5 liters per minute. But that is not the constant amount. The cardiac output varies widely with the level of activity of the body. So, what are the factors that affect cardiac output? So, cardiac output is stroke volume and heart rate. So, heart rate affects the cardiac output and the force of contraction of the heart, blood volume, and venous rhythm. Those are the main factors that affect cardiac output. So, what are the factors that affect heart rate? Okay. Autonomic innervation, hormones, fitness levels, age, all affect the heart rate. When they affect the heart rate, they also affect the cardiac output. Which are the factors affecting stroke volume? Heart size, fitness level, gender, contractility, duration of contractions, preload and afterload. Those all factors affect stroke volume and they also affect the cardiac output. So we talk about stroke volume. What is exactly stroke volume? It's the volume of blood pumped out of each ventricle per beat or contraction. When the stroke volume increases, the cardiac output is also increases. Look here. When the stroke volume increases, cardiac output also increases. So, stroke volume mainly depends on end-diastolic volume and contractility of the heart. Usually, the stroke volumes for each ventricle is equal, both being about approximately about 70 milliliters. But men usually have a larger size of heart. So, they have a higher stroke volume compared to the woman. So, how do we regulate the stroke volume? Stroke volume is regulated by mainly three variables. They are end-diastolic volume, total peripheral resistance, and the contractility of the heart. So, end-diastolic volume, what is that? It is the volume of blood in the ventricles at the end of diastole. So, sometimes it is called as preload. Okay. When the stroke volume increases, it increases with end-diastolic volume. So, when the preload increases, the stroke volume also increases. The second factor is total peripheral resistance. It is the frictional resistance in the arteries and it is inversely related to the stroke volume. So, when the total peripheral resistance is high, stroke volume is low. When the total peripheral resistance is low, stroke volume is high. So, the total peripheral resistance also called as afterload. So, the third factor is contractility. Contractility is the strength of ventricular contraction. When the contractility increases, stroke volume also increases. So, what is ejection fraction? Ejection fraction is the percentage of the end-diastolic volume that is ejected per cardiac cycle. So, we can calculate the stroke volume when we minus the end systolic volume from the end-diastolic volume. And ejection fraction can be calculated by stroke volume divided by end-diastolic volume into 100. So the normal ejection fraction is about 50 to 65%. Venous return. So the end-diastolic volume is usually controlled by factors that affect venous return. They are total blood volume and venous pressure. Usually veins have high compliance. They stretch more than arteries when given pressure because veins have thinner walls. So we call veins as capacitance vessels. It means that 2/3 of the total volume is in veins. So they hold more blood than arteries, but they maintain lower pressure in the veins. So what are the factors that related to venous return? They are the pressure difference between arteries and veins is usually about 10 millimeter per mercury. And the pressure differences in venous system. Also the sympathetic nerve activity and the pressure differences between abdominal and thoracic cavity and the blood volume. These are all factors related to the venous return. In previous slide, I told you as cardiac output can be varied. It can be varied according to contractility or the person. So, what are physiological variations of cardiac output? They are age, gender, altitude, pregnancy, exercise, and emotions. In age, cardiac output is usually more in adults than in children because the blood volume is more in adults. As we talked in previously, also in gender, cardiac output is more in male, as males have a bigger size of heart. And in altitude, cardiac output usually increases in high altitude doses. And in pregnancy, also cardiac output is increases because of the high demand. And also exercise and high emotional status also increases the cardiac output. What are the pathological variations of cardiac output? Cardiac output can be increased or decreased due to pathological reasons. What are the factors, pathological reasons that increase the cardiac output? They are the hypothyroidism and fever. What are the factors that decrease? They are hypothyroidism, hypovolemia, hemorrhage, and myocardial infarction. So, for measure cardiac output, we can use various methods. There are field principles, dilution methods, pulmonary artery thermodilution, Doppler ultrasound. Those are methods. But we don't need to go into depth. We just take around and know there are various of measures to measure the cardiac output. So what is the relationship with blood pressure to the cardiac output? Usually, I told you, cardiac output is made up of heart rate and stroke volume. Usually at rest, these are relatively constant. But when we exercise, heart beat faster. So, more blood is pumped out in each heartbeat, and it will contribute to a rise in blood pressure. So, when the volume changes in the cardiovascular system, it also affects the blood pressure. So, when a person was severely dehydrated or lost a large quantity of blood through wound, so there will be decreased blood volume in the heart. So, the heart has to pump low blood. So, thereby it reduces the cardiac output, leading to decrease in blood pressure. For a fit young person, the cardiac output might go up to about 12 liters minute peak of exercise. Okay. How do we regulate the cardiac output? It means regulating means maintaining constant cardiac output around 5 liters per minute under normal condition and adjusting the cardiac output as per the physiological demands. So, cardiac output has to be regulated to have optimal cardiovascular efficiency. So, what are the mechanisms? By venous return. So, the force of a contraction of a muscle fiber is proportional to its initial length. So, this principle is known as Starling law of muscle contraction. So, Frank Starling law usually states that within physiological limits, the heart pumps all the blood that returns to by veins. And so, when the venous return is increased, cardiac muscles stretch to a greater length. So, that ventricular muscle contract with greater force. So, that will lead to increasing cardiac output. So, the increased blood volume lead to increased stretching of the myocardium. So, that will lead to increasing the cardiac output. So, second one is by nervous system. The autonomic nervous system usually takes a major role in regulation of cardiac output. Whenever sympathetic nervous activity increases during emotions, exercise, it will stimulate both sinoatrial node as well as ventricular myocardium. So, this will both increase heart rate and also it will also the contractions of muscles. So, it will also increase stroke volume. So, that both the stroke volume and heart rate will be increased. So, this will increase the cardiac output. If parasympathetic activity, the opposite of this mechanism, so the cardiac output decreases because heart rate and stroke volume get dropped. So, the third one is hormonal regulation of cardiac output. So, whenever the adrenaline level in blood increases, it will stimulate sinoatrial node. So, and it will also the ventricular myocardium. So, this will increase both heart rate and stroke volume. So, when the both heart rate and stroke volume increases, you know it will inevitably increase the cardiac output. So, when the cardiac output is normal, this is the normal level. When the cardiac output is increased more than the level, it is called hypereffective. When it is decreased more than normal level, it is called hypoeffective. So there are definite limits to the amount of blood that heart can pump. So in this normal graph, it is usually the definite limit. So the plateau is about 30 liters per minute. When it is less than that value, we call hypoeffective. When it is increased, it is hypereffective. So in hypereffective heart, usually heart pumps more than the normal. But in hypoeffective, heart pumping ability of the heart is reduced. So what is hypoeffective heart? As we told, in this, the heart is pumping at a very slow rate. And the cardiac output is also decreases. When the heart rate is low, the cardiac output decreases. So what are the factors that can lead to hypereffectivity of the heart? They are the increased arterial pressure, inhibition of the nervous system, abnormal heart rhythms, coronary artery blockage, diabetic heart disease, congenital heart disease, myocarditis, cardiac hypoxia. These are some basic factors which will lead to cause hypoeffectivity. When these factors are present, the heart can't function in their optimum level. The function of the heart is reduced. But it's hypoeffective. In this, heart is pumping at a high rate and the cardiac output also increases. So, these some factors can make the heart better pump than the normal. What are that factors? They are nervous stimulation and hypertrophy of the heart muscles. So by nervous stimulation, it involves sympathetic stimulation and parasympathetic inhibition. Okay. In hypertrophy of the heart muscle, it involves the increased mass and it increases the contractile strength. And so when the contraction increases, it will lead to increase in the cardiac output. So what is pathologically high or low cardiac output? So in healthy humans, the average cardiac output is usually constant from one person to another. But in multiple clinical abnormalities, that can cause either high or low cardiac outputs. So in this session, we got a basic idea about cardiac output. In previous session, we talked about cardiac cycle. Now we talk about cardiac output. In next session, we are going to talk about blood pressure. The regulation of blood pressure. Okay. So the quick introduction to cardiac output is finished. Thank you guys for listening.